Many Americans receive federal stimulus payments. Some have been surprised to discover that their deceased loved ones also were sent money. Some of you are asking, what does that mean for relatives, and will they have to send the money back? Other people are still having trouble tracking their payments. KOMO's Tammy Mutasa is live in the newsroom with some help for us. Tammy?
Eric, it's just been really frustrating and confusing for a lot of people with these stimulus payments. Now people are wondering why they got checks for their loved ones who died. The experts helped us make sense of all this mess. Jan Bogle sent me this concern on Facebook saying, I received $2,400. My husband passed away in August 2018. I filed my 2018 taxes correctly. I believe I need to pay back $1,200. How do I get this done? Many people have voiced the same concern all over social media. So I asked the executive director of the Center for Taxpayer Rights and former taxpayer advocate for the IRS, Nina Olson.
If someone was alive in 2018 and the spouse died during 2018, but the 2018 return was correctly filed as married filing jointly, and they haven't yet filed their 2019 return, the IRS will look at the 2018 return and will send payments to both.
The Treasury Department said people will not have to pay back their stimulus payments on next year's tax return. Olson says neither do the relatives of dead loved ones.
That's a result of trying to get the money out now rather than making people wait until 2020.
That's not the only stimulus payment issue. I got at least 5 different messages from people who either haven't gotten their checks or had issues with the Get My Payment app to track their payment, like Dean McBee, who kept getting the message, payment status not available. The agency tweeted, the IRS Get My Payment tool is operating at record volumes, adding, you may get the message if you recently filed through the new IRS non-filers tool, if you get Social Security benefits, if you're required to file taxes and haven't filed for 2018 or 2019.
This is a mammoth undertaking.
The State Department of Health says hundreds of thousands of tests will be arriving in the next few weeks.
Today, our state health officer said that the DOH is trying to figure out how much testing is available in communities all across the state of Washington. KOMO's Kara Kostinich is live in Seattle with a look at how testing is going. Kara?
That's right, guys. And we were asking for a simple number today. How many facilities are testing? How many drive-through testing sites are they? And the state was not able to provide that number for us. They are working to gather that for us tonight. Governor Inslee said today, well, we do have enough lab space to do these tests right now. We simply don't have enough supplies for mass testing.
I think that this transition will not be a light switch on and off. It will be a dial.
And much more COVID-19 testing will be a critical part of that transition. More sites are emerging, like this drive-through in Lacey that will test anyone with symptoms, and another one in Aberdeen that can test up to 70 people per day. Local officials in Grays Harbor County say residents have honored the stay home, stay healthy order, but visitors have not.
We've had some influence from outside the area, especially when the weather's nice like this. Everybody likes to come out to the beach.
Public health officials are waiting to see if cases spike because of those visiting beachgoers. But the need for increased testing remains in many other communities across Washington. Dr. Chloe Bryson-Kahn is a physician with UW-Medicine.
Some people have very easy access to testing. Some have had a really hard time getting tests. And then another one of the hospitals that we work with, a critical access hospital, said they're having trouble getting swabs.
But good news for patients at UW-Medicine. The organization is now testing at up to a dozen of their facilities and drive-thrus. They can also turn up to 5,000 tests around every day. And patients simply have to show symptoms to get a test.
Opening up our access to testing and getting more and more folks tested is going to be crucial in our ability to, I think, safely, slowly open things up.
There are now 26 labs that will process COVID-19 tests in Washington. The State Department of Health said today those hundreds of thousands of test kits will be arriving in the next few weeks and will be sent to healthcare systems across the state.
My goal is really to get to the point where anybody who has a fever and a cough needs to really have access to testing that day.
Stay home, stay healthy has been rough on the financial health of tens of thousands of people who've been out of work because they're not in essential businesses. Numbers just out from the State Employment Security show for the week of April 5th through 11th, 585,000 claims were filed, $125 million paid to 265,000 unemployed workers. And since March 1st, $272 million paid out.
This is the most that has been paid in any week since the program began in the Great Depression in the 1930s.
And more money is coming. The Federal CARES Act rollout means an additional $600 to weekly amounts. Starting Saturday, they add on self-employed workers, independent contractors, and others not traditionally eligible.
So we have been working as swiftly as we humanly can, working around the clock to meet the needs of Washingtonians so that people can stay home and stay healthy and know that we're helping them mitigate the economic impact of that.
Hair salon owner Casey Mendoza says that's great news for her and her workers.
You know, they've got their bills and things like that to pay. So with the new addition coming of, was it 600? I think that is going to be an addition. That's going to be, you know, that's a lifeline to so many.
But there are those in the construction industry and other business sectors who say the state has to get rolling again. But the governor says testing ability is going to be the key.
The fact of the matter is that we are woefully short. We are 1,000 miles away from having enough testing equipment in the United States and in the state of Washington.
Well, we've heard it over and over again. Grocery workers are on the front lines of the COVID-19 pandemic because they see hundreds of shoppers every day. And we also know that for the first time, we're getting a glimpse at how many have tested positive for COVID-19. Tom Geiger is the grocery union spokesman for UFCW 21. He tells me that dozens of local employees at 10 stores have tested positive. We've also learned now that one local Safeway grocery store employee has died. Family and friends identified him as 70-year-old Sonny Quintlong, a part-time employee at a Safeway on Rainier Avenue South. A Safeway spokeswoman told me that they're very saddened. An associate from their Safeway store on Rainier Avenue South in Seattle recently passed away, and a Safeway spokeswoman says that he was a well-respected and beloved associate who worked part-time in their store. We heard from an employee's friend today who works at another grocery store.
I was shocked with the COVID-19 going on. It's just hit home because it may be a different store, but he's a Safeway employee. And Safeway employees are like families. So it was really sad.
Safeway responded to those concerns and also responded by saying, quote, "The health and safety of everyone who walks through our doors is a top priority. The Rainier Safeway, along with each of our stores, consistently undergoes regular cycles of enhanced cleaning, sanitizing, and disinfection through the store." Now, most stores in the Puget Sound area have been pushing for the safety of their employees by making sure that they all have disposable masks and gloves. They also installed sneeze guards, one-way aisles, and social distancing guidelines.